When mobilizing an ankle, we often use Voodoo Floss, which is just a simple compression band. There's many manufacturers of this one. For this one, we're using the Mobility Wad from Rogue Fitness. They should be in the range of about $10 to $15. We take it out to 100% stretch. I prefer to bring it down to about 60% stretch on the compression. We start at the distal end of the foot, stretch it out about 60%, and then all we're doing is we're just going around with about a 20% overlap, okay? Wrapping on up till you get right to that talocrural joint, and then from there, make sure you don't have any wrinkles in it, like I just did. Then from there, start doing your figure eights, okay? You want to come down as far close as you can to the calcaneus, and then we start wrapping in figure eights. Begin to overlap that figure eight nice and tight. Okay, make sure you capture just a little bit of that heel cap. That's not an area that people get a lot of swelling or edema, so we don't have to concentrate a lot in there. Once you realize you start getting to the end, go ahead and unroll it. Take your thumb right here, bring it around. That way you have something easy to tuck that excess into, okay? The first part of that ankle protocol, we find the dome of that talus, which we should be able to bring the patient in the dorsiflexion and still feel it underneath our thumbs. Just wrap around, cup it, and then we just begin easily mobilizing, driving it around in circles. Start small and then work your way through. You may get some good cracks and pops in there as you're doing it. Go through that circle about 10 times clockwise, then start going the other way, working it into counterclockwise. Nice and easy, okay? There's two simple talocrural distraction techniques to take that saddle joint and drive that talus away. It takes a good amount of force to get there. So again, make sure you're on the talus, cup down with your hands, okay? See how my elbows are out? And then I'm just gonna bring those elbows into me, pulling myself in to get that distraction, okay? Work that about 10 times. The other technique is to come back into that talus, into that web space of your hand, come in, cup that calcaneus, shift your body weight, and then all I'm doing is shifting my weight onto my front foot to get that distraction there. Again, about 10 times, working through that nice and easy. The ankle is a saddle joint, it's not a true hinge joint, so for that foot to come up and for your athlete to have adequate dorsiflexion, that talus needs to drive posteriorly into the joint. So again, come into that talus, cup it with your web space, cup that heel, and then bring that foot up on your thigh and start driving directly into the ground. Lock your elbow out and use your body weight. Especially on a heavier athlete, you need to use your body mechanics and get that posterior glide. After about 10 of those, kind of work a mobilization with some movement by driving posteriorly and bringing the foot up into dorsiflexion, okay? This is when you can get mean with the patient. You can kind of push pretty hard to get that range of motion. A lot of times that joint's locked up and guys that have been carrying a little bit of weight, lifting a little heavier, and get that posterior glide with mobilization. Keep in mind we got two bones that make the top of that talocrural joint, so they also have to split for that talus to roll up in there. Come on that lateral malleolus, nice little saddle right here in your hand, cup that lateral malleolus, come in the medial malleolus, hold up underneath, and then you're driving that lateral malleolus straight down to get a little bit of split between the tibia and the fibula, okay? And that should help you get dorsiflexion again. If you have an athlete that has some limited eversion, okay, cup that heel, come in with your forearm by the lateral border of the foot, come into that talus, and then you're going to drive down while hinging that arm, and just a simple motion there. So we're getting a little bit of that distraction, bringing them into the inversion. And then it's the exact opposite if they have some limited eversion. Drive down, distract that talocrural joint, cup the heel, bring your forearm, and then hinge that way to get a little bit of eversion. Okay, so that's the basic ankle protocol. Next, we're going to show you a fibular head glide, keeping in mind that tib-fib split. When we start talking about high ankle sprains and we get a tib-fib split here, that can be kind of locked up after a sprain. So we're going to work into an anterior fibular head glide, and we're going to show you that in the next video.